everyone, welcome back to Survival Addiction. Today we will be talking about NPAs and OPAs. So NPA means nasopharyngeal airway and OPA means oropharyngeal airway. Okay, so this is Patricia. I just made up that name. I haven't named her yet. This is my mannequin. Okay. So NPAs and OPAs are used to open airways. NPAs are used to open airways in conscious or semi-conscious patients. Okay, so this is Dynarex NPA. Okay. So when using an NPA, you want to measure from the tip of the nose to the earlobe. Okay, so I'm already wearing my PPE, pretend I have gloves on. Gonna lubricate it. Okay. All right, so then what I'm gonna do is I'm gonna give the patient a pig nose by pulling the nose up, having the bevel facing towards the septum, and I'm gonna go straight down. Sometimes you have to twist and stuff to get it down. Okay, so what this does is it opens an airway. Okay? All right. Like I said, you would only use this in conscious and semi-conscious patients. You could technically use it in an unconscious patient. But what's nice about NPAs is it doesn't activate the gag reflex. So it's unlikely that you're going to get thrown up on. If you have vomit coming up the esophagus, that's just going to cause issues. And hopefully they wouldn't aspirate, but it's possible that aspiration could occur. Okay, so I do recommend that all lay people have one of these on them. There's a couple reasons why you would have that, but there's also a couple reasons why you wouldn't want to use it. So if you suspect facial trauma or a skull fracture, like if the facial trauma is obvious, you wouldn't want to use one because it could cause more issues than it would help. Okay, so for this next one, this is the oropharyngeal airway. So it's this plastic device that you put in someone's mouth, and it goes down to the pharynx. It does activate a gag reflex. So the only time you could use this is in an unconscious patient or a conscious patient without a gag reflex. I wouldn't recommend using it in a conscious patient, though. There are two ways that you can use it. One is you put your hand on the top of the forehead like this, and then you go underneath the chin on the bony part, and you pull it up like that. The next is the jaw thrust. So the first one was the head tilt chin lift. The second one, you go under the mandible and you just pull it forward. And you would use the jaw thrust in situations where you suspect them having a spinal injury. But if it doesn't work the first time, it's okay to go ahead and do the head tilt chin lift because breathing is more important in the long run. If they're dead, it doesn't really matter if they have a spinal injury. Okay, so with an OPA, you're going to measure from the corner of the mouth to the angle of the jaw. Okay, so that's correct. So you're going to take your thumb and your finger and you're going to open their mouth. You're going to have the OPA facing upward, and you're going to put it in their mouth and then rotate down into the pharynx. I know, guys, that looks painful, right? Okay, like I said, you would only use this for someone who doesn't have a gag reflex. And this is used only to open an airway, not to secure an airway. To secure an airway, you'd have to use a different method. But vomit could still come up and block the airway, so they couldn't get air. So this would open the airway, but to secure an airway, you'd probably have to do a more invasive method. So again, we're going to take the thumb and the finger, open it, face this tipped up, push it back, rotate it towards the pharynx. And now the airway is open. Let me know what you guys think. I am thinking about doing medical videos every Monday. I think I'll probably call it Medical Monday, just because it, you know, uses the same M. Let me know what you guys think. Hopefully this video is helpful. Hopefully you guys will never have to use this. Thanks again for joining me at Survival Addiction. Don't forget to like and subscribe, and we'll talk to you guys later. Bye.